When you see me carrying this, what comes to your mind? That someone gave me a weighing scale for Valentine's Day? Raise your hand, those who think like that. Or somebody gave it to me on my way here. Anyone thinking like that? Yes? Or something else? Well, the real reason I brought it here today is because I want to talk about something very close to our hearts. Using the weight and height, we can calculate body mass index, which is known as BMI. How many of you have calculated your BMI? Yes, most of us have done it. So BMI is a simple formula that is used to assess health risk in a person. And having a BMI between 18.5 to 24.9 is considered as normal weight. Often, this group is considered to be healthy. But is it true all the time? So, let's go back in time. I was a postdoctoral researcher at Texas Tech University, and reading research on obesity was part of my job. So I was reading a lot of research articles and going through them, and one day I came across a research article which was so interesting, and it was on normal weight obesity. And I was thinking, normal weight and obesity have two different meanings, and I got so curious. So I started reading more. I read that paper from the beginning to the end. And then I read more papers. From what I learned, normal weight obesity is when a person has a lot of body fat and less muscle mass while having a normal weight. And you may have heard the term skinny fat, which is often used by people to refer to this. So, how do we know if we have normal weight obesity? You need to measure your body fat. And how do we do that? There are several ways of doing it. One is to measure the skin fold thickness, or you have to use a special machine like a bod pod or a DEXA scanner or a bioelectrical impedance analyzer. So once you measure your body fat, if the body fat percent is high, according to one guideline, it is more than 25% for men and more than 35% for women, it's considered as having too much body fat and considered to be as having normal weight obesity. However, remember, this is just one guideline. There are several guidelines describing different cutoff points. So how common is normal weight obesity in the United States? Any guesses? Is it 1 million, 2 million, 3 million? Any guesses? It's 30 million. I think somebody got it right. So it's about 30 million Americans in the United States have normal weight obesity. That's a very high number. And it gets more disturbing because most of these individuals don't know that they have increased risk for heart disease because of having excess body fat. After reading about normal weight obesity, I got really interested and started reading more on unhealthy lean. And then it hit me. This is not uncommon. I've seen this. I've seen a lot of this, and so have you. So my mind went back in time to my medical residency days. So now, let's go to the other side of the world, to a beautiful, small, tropical island in the Indian Ocean called Sri Lanka. I'm not going to talk about the tourist attractions today. That's for a different talk another day. But I'm going to talk about my experiences as a medical doctor in Sri Lanka. I used to work there as a medical doctor before I came to the United States to do my PhD in nutritional sciences at Texas Tech University. So when I was there, we used to see a lot of patients in the medical wards and in the clinic. And there were a lot of patients with heart disease, diabetes, high blood pressure, high blood cholesterol. And thinking back, not all of them had overweight or obesity. Actually, a lot of them looked lean or had normal body weight. And then I also remembered seeing young patients in their 40s or 50s admitted to the medical ward after a major heart attack, and not all of them had overweight or obesity. There were a significant number of them who were lean. So there are a group of individuals who have heart-related health issues like high blood pressure, high cholesterol, or high blood glucose while having a normal weight, and that type is known as metabolically unhealthy normal weight. So how common is this one? About 2 out of 10 Caucasian Americans can have metabolically unhealthy normal weight. And this number further increases to 3 out of 10 to Chinese Americans and African Americans. It further increases to 4 out of 10 for Hispanic and South Asians. So South Asians like me would have the highest risk of having heart-related health issues while having a normal weight. The actual percentage is about 44%, which is really high, isn't it? So in addition to having these heart-related health issues, some of these individuals with unhealthy leanness may have extra fat in the central part of the body and have less fat in the lower part of the body. And how do we know that? What is the easiest thing you can do at home? You have this instrument. This is called the measuring tape. So run that measuring tape around your waist and you would know. So having a waist size more than 40 inches for men and more than 35 inches for women is considered as having central obesity. And then there's another way. We can measure the waist size and the hip size, divide the waist by the hip to get the waist to hip ratio. That's another thing you can easily do at home. And remember to look at the ethnic specific cutoff values when you're doing that. So after listening to this, now you may agree with me. Not everyone who is lean is healthy. And at the same time, so many questions would be going in your mind, right? You might be thinking, what is this? How does it happen? What could I do? What can they do? Is there something we can do to reduce heart disease? At this time, we don't have much research done in this area to answer all those questions because the amount of research on unhealthy lean is very minimal compared to what we have done on obesity. However, based on the limited number of research that is available, we do know a few things. Like, it's found that people who are having unhealthy leanness are less physically active, and they tend to have low physical fitness. In addition, some research studies suggest that they may be consuming unhealthy dietary patterns, like they may have frequent snacking or consuming high carbohydrate containing snacks. Or their intake of saturated fat is high with a low dietary fiber intake. What else do we know? So we also know that as we grow older, the amount of body fat in our body increases and the muscle mass decreases unless we do something about it. So as a person grows older, the risk of them having unhealthy leanness is increasing. We also know that genetics have a big impact on biological factors. Similarly, some studies suggest that if an individual has parents who have heart-related health issues, their risk of becoming unhealthy lean increases. However, the amount of research done in this area is very minimal, and we need more research done to understand better. There must be a lot more causative factors which we don't know about, and it is highly likely that unhealthy leanness is part of the spectrum of obesity, which we don't detect because we are using that wrong tool. Obesity, as you know, is a complex disease which has so many factors contributing to it, like biological, environmental, psychosocial, behavioral, which are going beyond diet and exercise. So similarly, it is highly likely that unhealthy leanness also has many other factors contributing to it. Now, I want you to close your eyes for 1 second and think, do you know someone who may be at risk of being unhealthy lean? That person you thought is likely to be you or someone you care about. For me, that person is me. So what can we do? the research community and the medical community needs to come together. They need to come to an agreement on the definitions for unhealthy leanness. And that will help the medical communities or healthcare providers to identify unhealthy lean individuals early on, and early diagnosis will help to prevent any life loss or have better health outcomes. And another thing they can do is to identify ways to prevent heart disease risk in this group. And then what can you do as an individual? If you think you are at risk of being unhealthy lean, be proactive. Engage in physical activity. Try to eat a healthy, balanced diet. And if you think you have unhealthy leanness, consult your physician. Get your blood checked out. And if you have any heart-related health issues, it's better to do the needful. And most importantly, remember, everyone who looks lean is not healthy. We need to respect diversity, celebrate different body sizes, and avoid stereotyping. So let us be more health conscious, less weight conscious, and lead a healthy life. So I am going to take care of my heart health, and I hope you will do the same. Thank you.